Hello and welcome to this presentation about Medicare options. This presentation is for people who have Medicare and have received a letter that they are losing OHP or Medicaid benefits. My name is Jody Delcier and I'm with Sheba of Lane County, Oregon. This presentation is recorded in November of 2024, so please be aware that information shared in this presentation may change as time goes on. Today we will answer the following questions. Why are changes happening to Medicaid and Medicare Savings Program recipients? What financial assistance programs are available to those on Medicare? What are my Medicare options? How do I explore my options? And what are my next steps? First, let's talk about why the changes are happening. During the COVID-19 public health emergency, individuals were permitted to stay on OHP even if they had a change that would have made them ineligible otherwise. Now that the public health emergency has ended, Oregon has begun the medical renewal process for those on OHP to redetermine eligibility. Here's what this means for you. When you receive a renewal notice, you have 90 days to respond with information. If you are determined to be ineligible for OHP, you will receive a notice with the date on which your OHP benefits end. From there, you need to seek other coverage. If you're Medicare eligible and losing OHP, this video will help you learn about the other coverage options available to you. Next, let's talk about the financial assistance programs that are available to those on Medicare. There are two types of financial assistance programs that you may be eligible for. The first type is called Medicare Savings Programs. With these programs, the state pays for your Medicare Part B premium. If you're under a certain income limit, it may pay additional medical expenses too. The second type is called Extra Help or Low Income Subsidy. With this program, the Social Security Administration pays for some of your Part D premium and also brings down the cost of generic and prescription drugs. During your redetermination process, Oregon Department of Human Services will screen you for these programs. If you no longer qualify for full Medicaid but remain eligible for Medicare Savings Program or Low Income Subsidy, the letter you receive from ODHS will include the phrase Mixed Eligibility Decision and describe the program that you qualify for. If you have questions about these programs, contact the Oregon Department of Human Services Oregon Eligibility 1 Customer Service at 800-699-9075, TTY 711. Regardless of your financial assistance eligibility, now is the time to learn about Medicare options and decide which one will work best for you going forward. Medicare has 4 parts: Part A, Inpatient Hospital Insurance; Part B, Medical Services and Supplies; Part C, Medicare Advantage; and Part D, Prescription Drug Insurance. Additionally, there are also Medicare supplemental plans, which are policies that you can purchase to cover costs that Medicare doesn't cover. Using these parts of Medicare, you have 3 pathways to choose from. Original Medicare, Part A, B, and D. Original Medicare A, B, and D plus Medicare Supplemental Plan, also known as Medigap. Or Medicare Advantage, also known as Part C, which typically includes prescription drug coverage. Let's talk about each of them. We'll start with Medicare Part A, B, and D. When you turn 65 or have been on Social Security disability for 2 years, you are eligible for Original Medicare. Many people are automatically signed up for Part A and B at that time. If that's the case with you, then you won't need to take any action to keep Part A and B. If you don't have Part A and B yet, you should call the Social Security Administration at 1-800-772-1213. Then you will also consider a Part D prescription drug plan. These are managed by private insurance companies and you sign up separately. When you lose your Medicaid, you have a 3-month enrollment period to start or change a Part D prescription drug plan. There are a few reasons why you might choose Part A, B, and D. First, it's flexible. You can see any provider who accepts Medicare. Second, if you travel, Medicare can cover services with providers across the country. Third, it's stable. There are fewer surprise charges or changes in coverage with Original Medicare. There are a few potential drawbacks to consider too. First, there is no medical maximum out-of-pocket. For your medical costs, Medicare will pay 80% of the bill and you'll be responsible for 20%. This can get expensive. If you land in intensive care, for example, 20% of that bill could be very costly. Second, you may need additional insurance if you would like dental, hearing, or vision coverage. Medicare does not cover these things. Now let's talk about Medicare supplemental plans, also known as Medigap. This is an optional product that you can purchase from private insurance companies that works with your Original Medicare. They can cover co-payments, co-insurances, and deductibles. When you lose Medicaid or OHP, you have a 63-day window to purchase a Medigap when they can't deny you based on any of your medical conditions. There are 10 different types of Medigap plans, all with different coverage levels. Pause the video to compare plans. The price varies based on your age, gender, tobacco use, and the company offering the plan. Licensed insurance agencies must help you with these policies. Why might you choose to add Medicare supplement insurance or Medigap to your Part A, B, and D? You'll have the same flexibility, travel, and stability benefits as we discussed with Original Medicare, but with a Medigap, you're also limiting those out-of-pocket costs because a Medigap can cover deductibles, co-payments, and co-insurances. This option is also predictable. You'll be paying the same amount every month, no matter how much you use it. Think of it like a healthcare subscription rather than a pay-as-you-go model. It can also provide peace of mind since you know you're covered even if unexpected healthcare situations should arise. What are the potential drawbacks of getting a Medigap? It is a monthly expense, which you'll pay whether or not you actually use medical services. The premium usually increases with age, gender, and tobacco use. It increases yearly and may be expensive. Plan premiums vary, so consult with a licensed insurance agent to learn about rates. Additionally, there are limited times in your life when you can get a Medigap without undergoing medical review. Losing Medicaid or OHP is one of those times, but if you ever disenroll from your Medigap, you might not have the opportunity to re-enroll again later. Lastly, let's talk about Medicare Advantage or Part C. These are plans that are managed by private insurance companies instead of the federal government. Medicare Advantage plans must have coverage that is at least equivalent to Original Medicare Part A and B. Medicare Advantage plans often include prescription drug coverage, which takes the place of a Part D, so it's an all-in-one plan. Note that to have a Part C, you must first have Part A and Part B. That means that you're still paying a Part B premium even if you're using a Medicare Advantage plan. When you lose your Medicaid or OHP, you have 3 months to enroll in or change a Part C plan. Why might you choose a Medicare Advantage or Part C? Medicare Advantage plans often offer additional benefits that Original Medicare does not, including vision, dental, hearing, and wellness programs. Costs are a factor. If you don't go to the doctor much, you could have a lower premium and pay as you go for the limited visits and procedures that you do have. You might also find it convenient and easy to keep track of since it's an insurance plan that covers everything in a single plan. What are some potential drawbacks of Medicare Advantage Part C? You may have limited provider options. Medicare Advantage plans have a list of in-network providers that you can access. If the provider of your choice is out of network, you'll pay more to continue seeing them. You might also face more out-of-pocket costs if an unexpected medical situation arises. The co-payments and co-insurances can add up quickly. And you'll need to stay on top of annual changes as Medicare Advantage plans are subject to change from year to year. This concludes the informational part of the video. Now we will show a demonstration about how to use Medicare.gov to explore your options. If you're comfortable with navigating websites with a computer, feel free to follow along. If you aren't, you can call Sheba to get help at 800-722-4134. For the purposes of this demonstration, we'll make up a persona for our search. We'll call her Linda. She is 70 years old and lives in Springfield, Oregon. She takes medication to manage high blood pressure, arthritis, and depression. She goes to the doctor twice a year for the high blood pressure and arthritis, and sees a therapist once a month for the depression. She has been approved for extra help. Before we continue, remember that this video was recorded in November of 2024, so information that is on display at the time of this recording may have changed by the time that you're viewing. Additionally, any plans that we discuss during this demonstration are for demonstration only and are not specifically endorsed by Sheba. Okay, let's go to Medicare.gov. At this point, we can create a Medicare account where you can save all of your Medicare information to your profile. But for this demonstration, we'll continue without making an account. We'll click on the green Find Plans Now button. Again, we're looking at this website in November of 2024, so we have the option to look at plans for both 2024 and 2025. But we'll look for plans for 2025 just for today. Linda's zip code is 97477, and we'll click Continue. First, she wants to look at Original Medicare Part A, B, and D. She already enrolled in Part A and B at 65, so she's looking at Part D now. So we'll click Medicare Drug Plan Part D, and then the green Find Plans button. Next, the website asks if you get help with your Medicare health or drug costs. Linda is in the Extra Help program, so we'll select that and click Continue. Do we want to see our drug costs when we compare plans? Yes. Next. Now we'll enter in prescriptions. Linda takes amlodipine for high blood pressure. She takes 5 milligram tablets every day, so 30 a month. We'll add this to the drug list. Now we'll add another drug. She takes celecoxib for her arthritis. She takes a 100 milligram capsule twice a day, so 60 a month. And last, we'll add the sertraline that she takes for depression. She takes 50 milligrams daily, so 30 a month. Once we confirm that this drug list is accurate, we can click Done Adding Drugs. Next, we'll add the pharmacies that Linda visits. Different drug plans have preferred pharmacies that get better drug prices, so it's good to pick a few. Let's say Linda is good with trying a mail order pharmacy, Fred Meyer Pharmacy, and Walgreens. Now we'll click Done. Now Medicare.gov will generate a list of prescription drug plans that are available to Linda from least to most expensive based on lowest drug and premium cost. The extra help that Linda gets from Social Security is already accounted for when calculating these options. It looks like the 3 least expensive options are WellCare Value Script, Cigna Healthcare Saver, and Cigna Healthcare Assurance. So let's compare the 3. To do that, click the Add to Compare button at the bottom of each plan, and each plan will come up on this blue comparison ribbon. You can compare up to 3 at a time. Now click Compare, and it will show a side-by-side view of all 3 plans. So you can see that the star grading for WellCare is higher than the other 2, and the premium and deductible are the same across the board. WellCare and Cigna Saver offers the cheapest medications overall. If Linda goes with a mail-order pharmacy, she can expect to pay $19.60 for all of her medications for all of 2025. If she's hard set on going to Fred Meyer, though, you can see that WellCare is the least expensive option for that pharmacy and is actually out of network if she goes with either of the Cigna plans. Let's say Linda is good with mail-order pharmacy but wants to be able to access Fred Meyer in a pinch if she has an unexpected and urgent prescription come up. So she wants to learn more about the WellCare plan, since that one has Fred Meyer Pharmacy in network. She can click on Plan Details. From there, she can get a breakdown of how much each drug costs at each pharmacy and what she'll pay from month to month. If Linda decided that this is how she wants to move forward, she can scroll up and click on the green Enroll button at the top of the screen and sign up on her own. Or she can enlist the help of Sheba or an insurance agent to help her out, and she can go to that appointment knowing that this WellCare value script is one that she's considering. Okay, let's say that Linda is happy with this Part D, but also wants to add on a Medigap. Let's look at how that works. Again, we'll go to the Medicare.gov homepage. You can type that up in your search bar, or you can just click the Medicare.gov logo in the top left of this page. Again, we'll go to Find Plans Now, and her zip code is 97477. And now we'll select Medigap Policy and then click Find Plans. To get the most accurate price, we're going to enter some information about Linda. So her age is 70. She is female, and she does not use tobacco. Let's say she doesn't have a spouse or roommate who is also getting a Medigap, so she won't be getting a household discount. Then we'll click Update Prices. Now we choose which Medigap plan to look more closely at. As you scroll along, you can see price estimates for each of the plans. You can also click Compare to Other Plans on any of these to pop out that handy chart from earlier in the presentation. We'll say that Linda looked at this Medigap chart and decided to get the most coverage possible, which happens with the Plan G. So we'll scroll down to Medigap Plan G, and we'll click View Policies. According to Medicare.gov, the least expensive policy right now is with Aflac. She'd be paying $162 a month. Next is AARP, United Healthcare Insurance Company, at $172. Now, a Plan G is a Plan G no matter who you get it from, so Linda would most likely go with whatever option is the cheapest. However, notice that these costs are estimates and may change. Medicare.gov doesn't always have the most up-to-date pricing, so Sheba can help you find more up-to-date pricing, but ultimately, Linda will need to go buy her Medigap through an insurance agent. So let's find her an agent that's trusted by Sheba. We'll open a new tab and go to sheba.oregon.gov. Then, under Medicare Help, we'll click Medicare Help Near You. Then, under Find Local Help, we'll enter Linda's zip code 97477. We're looking for Medicare agents, and now click Search for Help. Then, here is a list of Medicare agents in Springfield and Eugene that can help with her Medigap. Okay, let's back up a little bit so that Linda can look at some Medicare Advantage plans. Again, we're going to go to the Medicare.gov homepage. Then back to Find Plans Now, enter her zip code, select Medicare Advantage Plan Part C, and Find Plans. Select Extra Help with Drug Costs and continue. Looks like it saved her prescription preferences from earlier and saved her pharmacies from earlier as well. So we'll click Done. Now Medicare.gov is showing a list of 37 Medicare Advantage plans sorted by lowest drug and premium cost. Saved the Part D plans from earlier, so we're going to clear out the comparison. And we're going to add in the 3 least expensive plans available to Linda. So it looks like AARP Medicare Advantage Essentials from UHC OA-4, then Atrio Choice RX, and WellCare Simple Open. And it looks like there are a bunch of plans that she could be looking at, but for the purpose of this demonstration, we're going to stick with these 3. So we will click the white Compare button. Similar to when we were looking at Part D prescription drug plans, the cost savings from extra help is baked into the calculations here. So let's compare. AARP has a slightly higher star rating than the others, and they all have the same deductible costs. For maximum you pay with health services, you can see that Atrio and WellCare options show 2 possibilities. The max that you pay if you only use in-network providers, and the max that you pay if you use both in and out-of-network providers. These 2 plans are PPOs, and so they do allow you to use out-of-network providers. For this AARP option, it's an HMO POS, which means you're only allowed to use a more limited number of in-network providers. It looks like this WellCare option has the lowest maximum out-of-pocket costs if we stick with only in-network providers at $3,450 a year. Now we can look at plan features. This is a very broad overview and doesn't include specific pricing, but if Linda's prioritizing transportation benefits, it looks like Atrio is the only one of the 3 that offers those. It looks like 2 of these plans offer routine chiropractic service, and it looks like the AARP plan doesn't offer as many dental benefits as the other 2. The comparisons can go on and on, so it's important to look at all of this carefully. Next, we can look at the copayments and coinsurances for doctor visits. Remember that Linda goes to her primary doctor twice a year, and so if that doctor is in-network, it's a $0 copay with each of the 3 plans. Atrio and WellCare, you can go out-of-network, and for a primary doctor with Atrio, that would be $50 for an out-of-network copay. With WellCare, that would be $30 for an out-of-network copay. As we keep comparing, we can see prescription coverage. I have to scroll down quite a way. Remember, it's a lot to look at, and so be sure to be comparing pretty closely. But we scroll down and we get drug coverage and costs, and it looks like no matter where she goes, whether she gets mail order or not, all of her prescriptions are covered in full for the rest of 2025. She can go back and keep comparing plans if she likes, but to keep this demonstration short, let's say that Linda is liking the look of the Atrio Choice plan and wants to look a little bit more detailed. So she can click on Plan Details, and here it will show most of the things that you would see in a summary of benefits for the plan. Remember that Linda has monthly mental health therapy visits, so this is a good place to see what those look like with this plan. She can click on View More Benefits and Costs, and here's mental health services. And an outpatient individual therapy visit is a $20 copay in-network or 50% coinsurance out-of-network, so that's good for her to know. Next, we should check if Linda's providers are in-network. Most plan websites have a provider search function, so let's scroll all the way up and click on Plan Website. This will open up a new tab with the Atria website. And each plan's website is different, so we won't go into detail about how to find providers on the Atria website specifically, but check in the enrollment materials or the member materials to see if there is a provider portal on whichever website you're looking at. And you can type in the name of your provider and make sure that they're in network or not, just to make sure you have your bases covered before you sign up. So, as you can see, there are a lot of factors to consider when deciding which Medicare pathway is right for you, but hopefully this demonstration showed you how to use some of the online tools to explore what's out there. Now that you know how to explore your options, let's talk about next steps. First, confirm the date that you're losing Medicaid or OHP so that you can start your new coverage the following month. This date will be in a letter that you received from the Oregon Department of Human Services. This letter will also include information about which assistance programs you're eligible for, if any. Second, explore Medicare.gov to find a Medicare option that works for you. Third, enroll in the plan of your choosing or enlist the help of a Sheba counselor or licensed insurance agent to finish the job. Thank you for watching this video. We wish you all the best as you move forward with this process. If you would like to talk to a Sheba counselor, please call us at 800-722-4134.